Episode 4 of our lithium rundown. So today we're going to be discussing lithium side effects. So let's look at lithium as the good, the bad, and the tremors. Lithium is like that friend with quirks. Some are funny, some are annoying, and a few can be downright dangerous. As a nurse practitioner, your job is to know which side effects are just part of lithium's personality and which means that it is time to intervene. And on exam day, trust me, they love testing if you can tell the difference. So today we are breaking it down, the good, the bad, and the tremors, and why these side effects happen. So let's discuss some common early side effects. They are annoying, but they're not dangerous. Let's start with the mild stuff. The side effects that show up early and make patients uncomfortable but usually don't mean there's danger. GI upset. Some individuals will begin to experience nausea, diarrhea, and abdominal discomfort. Why is this so? Because lithium irritates the GI tract directly, especially as blood levels of lithium begin to rise. Fine hand tremors. This is a classic one. Why does individuals experience fine hand tremors? Lithium interferes with neuronal signaling, making those hands just a little shaky. Pay attention in an exam. Fine tremors is okay, but when the question says coarse tremor is equal to toxicity, and that is a red flag. Polyuria and polydipsia. Patients might say, I'm always thirsty and running to the bathroom. Why? Lithium reduces kidney responsiveness to antidiuretic hormone, your ADH. That's your mild nephrogenic diabetes insipidus. How about weight gain? Mechanism isn't fully clear, but partly due to fluid retention and increased appetite. So remember, it's not a reason for you to stop lithium right away, but you should always document and monitor your patients. Endocrine side effects. This is a high yield exam content. Now, this section, you must know code for the boards. Hypothyroidism. Why does it occur? Lithium blocks thyroid hormone synthesis and release. That's why some patients develop a goiter. So baseline TSH, it's important before starting lithium. Then you want to recheck every 6 to 12 months. Individuals may experience hyperparathyroidism and hyperkalemia. Why? Lithium alters calcium regulation at the parathyroid gland. This can cause bone loss, kidney stones, and even mood changes. If you see fatigue plus elevated calcium plus lithium use, the question is probably pointing towards this mechanism. So pay attention when you're reading those exam questions. Now let's discuss some renal side effects. And this is the classic lithium issue. You must know this. The kidneys take the biggest hit over time. Remember nephrogenic diabetes insipidus? Why? Lithium damages the collecting tubule cells, so the kidney stop responding to ADH. Symptoms include polyuria, polydipsia, and dilute urine. Chronic kidney disease. Why does this happen? Or why should you look out for individuals with chronic kidney disease? Long-term lithium exposure causes interstitial fibrosis and scarring. Pay attention because this is a high yield content area. This is why you always check BUN and creatinine before starting. Even when levels are normal, lithium can silently cause gradual kidney decline. So, lithium and kidneys, always a long-term relationship you have to supervise carefully. Let's look at some neurogenic and cognitive effects. Cognitive dulling. Your patients may say, I feel a little slow or foggy. They might describe motor issues, mild coordination or balance problem. How about their skin? They might begin to develop acne or psoriasis might flare up. Lithium can worsen these skin conditions. Remember that when the symptoms are in the mild area, like the early symptoms we talked about, it doesn't warrant that you discontinue the medications, but you must monitor. Now we're going to discuss serious or long-term risk. So now let's talk about the big red flags, the ones that make you pause before refilling that prescription. Cardiac arrhythmias. A patient is presenting with cardiac arrhythmias. For your exam, always order an ECG for patients over the age of 40 or with a cardiac history. Irreversible renal damage, possibly after years of therapy if not properly monitored. So kidneys and hearts, always part of your long-term safety plan. So when you're managing individuals on lithium, you want to pay attention not only to the present, but for the future. That's why it's important to continue to monitor their kidneys. And of course, you want to monitor that cardiac before starting an individual on lithium. Let's look at some very important reproductive consideration. Pregnancy. In the first trimester, lithium can cause Epstein-Barr anomaly, and this is a rare tricuspid valve defect. In later pregnancy, it can also cause floppy infant syndrome. So what this tells me is that before you start an individual who is within that childbearing age, you want to be doing HCG on them so that you can mitigate these complications. Breastfeeding, lithium passes into breast milk, so it's generally avoided. So for your exam purposes, if the question asks for a safer pregnancy alternative, your answer will be lamotrigine. Let's look at a clinical scenario. You have a 29-year-old woman on lithium who reports fatigue, weight gain, and dry skin. And you check TSH, it is elevated. So what is happening? Of course, this is lithium-induced hypothyroidism. And how would you manage this? Are you going to stop the medication? At this point, if that individual is controlled on lithium, your best decision is either to start that individual on levothyroxine, or you refer to endocrinology or collaborate with endocrinology. But you want to continue lithium if it's working, because we don't want to risk throwing our patient into manic episodes. So don't stop instantly or abruptly. Let's look at another case. A 40-year-old man on lithium develops polyuria and polydipsia. Urine is dilute with low specific gravity. This will be nephrogenic diabetes insipidus from lithium. And how will we manage this? We want to monitor renal functions. Sometimes we might add medication depending on what you are asked if it's persistent. Clinical cases like this are exactly how exam question tests if you understand the why behind side effects. Let's do a little recap. Fine tremors is a side effect. Coarse tremor is a toxicity. You want to always monitor thyroid and kidney labs. Very important. You also want to watch for endocrine, renal, and cardiac red flags. For your exam and in practice, remember this simple rule. Lithium hits the kidney, thyroid, and heart. Those are your most monitored systems. So in the next episode, we'll put it all together. We're going to discuss lithium toxicity, recognition, and emergency management. You'll learn what symptoms show up first, what to do fast, and how to rescue your patient before it is too late.